about to embark upon a major lifestyle change. I wanted to do a quick video before I get started with what changes I'm going to be making. And I'm doing this video because I want it to be something that can help other people. I have not been diagnosed with any disease other than hypothyroidism, and it is my goal to reverse that through diet and lifestyle changes. The past month, I have been really not living a very healthy life, eating a lot of cooked foods, eating a lot of processed foods. Yesterday, for instance, I had some quinoa, and I added some Bragg's liquid aminos, which I've been forewarned that that stuff was bad, and I realized how bad it was yesterday. After eating that meal, it was a very simple meal of just some beans and some quinoa with a little Bragg's liquid aminos. After eating that meal, my tongue became swollen, my throat, my pharynx became swollen. It was hard to swallow. I developed wheezing, my stomach became swollen, even my ankles looked swollen. And I know that Bragg's liquid aminos contains glutamate, or MSG, and I think my body was reacting negatively to that and to the salt that's in that stuff. So, when you have too much salt in your diet, salt is a poison. It's refined. We shouldn't be consuming salt. So I think all of the salt led to the swelling, led to the swollen tissues, and my body responded negatively. So these are just things that I notice. Maybe it's because I do try to eat a primarily healthy diet, but I've not been eating very healthy for the last month. A lot of alcohol, alcohol in the form of margaritas, in the form of mixed drinks, in the form of wine, a lot of cafe mochas. Although it is vegan, I use almond milk or soy milk, and vegan chocolate. It's all processed. So anyway, that's just a little brief synopsis of where I am. Some symptoms that I'm going to share with you now, in addition to physically how I look. My breathing, because of the cooked foods I've been eating, my breathing has been negatively affected. It's harder for me to breathe, especially in the right part of my chest. I had a chiropractor back in 2004 do an upper cervical adjustment, and I believe he tore my scaling muscles, and ever since then I've had a lot of breathing problems, never feeling like I can fully inhale right here into the upper lobe of my right lung. I sometimes feel pain in my liver, probably because of all the crap I'm eating, maybe because of the coffee and the alcohol, which are both very hard on the liver. Some heartburn. I typically notice that when I eat cooked foods or foods high in salt. What else? The allergies. I had an allergic response, I believe, to the cooked foods, especially to the Bragg's liquid aminos. In addition to swelling up, I woke up this morning with my eyes completely red and sneezing a lot, hard time breathing, and obviously the hypothyroidism. I was diagnosed with hypothyroidism, I believe, when I was 12. I believe that this came about as a result of treatments that I had endured, treatments that were told, or I guess suggested to my parents when I was sick with pneumonia, maybe the dental amalgam fillings that were in my teeth. I don't know. I think that, if the body is not messed with, you don't develop disease. And how do we mess with our body? Well, there's lots of ways. I mean, the air we're breathing in, the processed foods, the foods that have been treated with herbicides, fungicides, pesticides, insecticides. All of those chemicals are unnatural, and they can change your physiology. They can change your genetics. They can mutate your genes. So that's bad. Cigarette smoke, toxic substances we take in, drugs, both over-the-counter drugs, and, things that are prescribed to you, things that you buy at Walgreens or whatever drugstore you go to, and even illegal drugs. They're all bad for you. Alcohol is a drug. What else? Toxic thoughts, stress. All of this can affect your physiology, and this is why we get sick, and this is why in America the cost of health is skyrocketing. It's ridiculous. It's all ridiculous. So I'm stepping out of it. I'm getting out of it. I'm reading this book called The Gerson Therapy, the proven nutritional program for cancer and other illnesses. I don't have cancer, and I'm following this protocol, not to the letter, but I'm going to be doing a lot of what it suggests, maybe a little even more stricter than what it suggests, because I believe in prevention and protecting myself, and I know that I've not really been living a healthy lifestyle, and I'm sick of it. I'm sick of the man, or whoever we want to call this entity, the globalists, whoever is trying to control us, or maybe it's not they, maybe it's just the ego. I don't know. But I'm sick of it. And I'm ready to step out of it. Stepping out of the box, stepping out of whatever it is that is driving me insane, because it's all insanity. Some things I wanted to share from this book that I found very interesting. Dr. Gerson's healing program is advantageous for overcoming nearly every pathology and far superior to cancer chemotherapy. Statistically, for instance, chemotherapy boasts an overall remission rate of, on average, 12%, 7% for colon cancer, 1% for pancreatic cancer, for patients first seen at early and intermediate stages of their illnesses. The Gerson therapy, on the other hand, has a remission success rate of 42%, largely of terminally ill, so people that have cancers that have more progressed. You don't see that kind of effect with chemotherapy. So what's more, the Gerson Therapy nutrition program works permanently, in a surer manner than all other known therapies, including cytotoxicology, which is what chemotherapy is, immunology, pharmacology, radiation therapy, and other usual procedures provided by conventionally practiced allopathic medicine. The goal of Gerson therapy is to restore all essential organs. Gerson therapy has been shown to help with many diseases, not just cancer. Let's see. Here are some of the health problems successfully treated by the Gerson therapy. Maybe you have one of these. Acne, addictions, AIDS, allergies, anemias, ankylosing spondylitis, arthritis, asthma, cancers and leukemias, candida, chemical sensitivities, chronic fatigue syndrome, constipation, Crohn's disease, Cushing's syndrome, depression, panic attacks, diabetes, emphysema, endometriosis, epilepsy, fibroids, fibromyalgia, genital herpes, gout, heart and artery disease, hemorrhoids, hepatitis, high blood pressure, hyperactivity, hypoglycemia or hyperglycemia, immune deficiency, infertility, intestinal parasites, kidney disease, liver cirrhosis, Lyme disease, lupus erythematosus, macular degeneration, migraines, mononucleosis, multiple sclerosis, obesity, ocular histoplasmosis, osteomyelitis, osteoporosis, phlebitis, premenstrual syndrome, psoriasis, shingles, stroke, tuberculosis, and ulcerative colitis. So, if you're sick, take your health into your own hands. I would go on to Amazon or your bookstore and get this book, read it, and and take control of your health. So what am I doing? You know, this book is part of what I'm doing to change my life. I am going on a juice feast. And basically, for as long as I feel I need to, I'm going to be consuming green juices and fruits in the form of mono meals. Here's my vegan shirt. I'm a vegan, by the way. There's this really funny picture, I'll post it, about how do you know if someone's a vegan? You'll see. Anywho, so I'm going to start with doing some green juices for about 10 days, consuming about 4 pint jars of green juice every day. And what is a green juice? It's basically a juice where most of it is made up of green leafy vegetables. I'm also going to be growing my own wheatgrass and sprouting some sunflower seeds. So I'd like to thank my Facebook friend Tony Mix for providing me with some of the essential materials to help me do those things. So that's one thing I'm going to get into. And and adding a little bit of sweetness to it in the form of some fruits. What else? So green juices are going to be making up the majority of what I'm going to be consuming. After that, I might take a few days and just do some mono meals of fruit. Like maybe for a whole day, just eat nothing but watermelon. And then go back to the green juices. After that, for as long as I need to do that, until I feel 110% better, then I'm going to maybe switch to some green smoothies, and then just go back to a raw vegan diet. So that's the goal. I'm giving up alcohol. I'm giving up coffee. And I'm really going to treat my body as a temple. And I'm documenting this. I'm going to try to do daily videos. I go back to teaching June 4th. So, you know, I'll be pretty busy this summer. I'm teaching 3 classes. So that's going to keep me pretty busy. But I'm still going to try to do these daily videos. I want you to take a good look at me, though, because I don't feel very healthy right now. Like I said, I've been eating cooked foods and processed foods. Even though they're vegan, doesn't mean they're healthy. And I've been drinking too much alcohol, drinking too much coffee. And it's funny, because even though I say doing this too much, most people would probably look at what I'm consuming and thinking, oh, that's normal, that's healthy. It's not. What you see in a population of sick people that are overweight, you know, just go to Walmart. Look at what you see at Walmart. I go to Walmart in my town and I just look at the Walking Dead, the sickness, and people think that's normal. You know, we think that being sick, you know, not being able to walk because you're morbidly obese, you know, and getting cancer and having to be put on all of these drugs, that is not normal, people. This is not normal. Take control of your health. And I'm hoping that I can inspire you to do that, because I'm going to be taking charge of my health. Like I said, I'm not really that sick, but I'll be damned if I get sick. I've got too much in my life that I want to do. I've got a lot of work to do. And I'm not going to be part of a statistic of where humans are headed, because it's sickening to be given this life, this beautiful life, this gift, and to treat it like crap. And again, I'm not blaming the doctors. I'm not. Because I went to medical school. When you look at any medical school education, medical students study more pharmacology than they do nutrition. So they just don't know. They don't know. Allopathic medicine is disease maintenance. That's what it is. It's maintaining diseases. It's not health. There's no health going on. Treating people through drugs is not health. Drug therapy should be a last resort, and we're treating it as the blue magic pill that's going to make everybody's life better. If you want to make your life better, take control of it. Don't take the easy route. So anyway, day 1 begins tomorrow. All right? I'll share with you some of my green juicing recipes, and I hope to inspire you. And I hope, look at me now. Look at how crappy I look. I feel puffy. I feel like swollen all over. I hope that my body looks a little bit different as I go through this. So anyway, goodbye.